My name is Dr. Sandeep Reddy. I practice diabetes and endocrinology in Dilshanagar. I'm a physician. Uh, Today I'm going to talk about diabetes. Actually, what is diabetes? Diabetes is a disorder where excess glucose content is there in the blood, so that it harms our body. So, who gets diabetes? Generally, patients who are obese, who are very inactive, who don't do a lot of exercises, hereditary, who have family history of diabetes, will get diabetes. What is diabetes? Basically, diabetes is a deficiency of a hormone called insulin, which is produced from an organ called pancreas, which is there in the patient's stomach on the left hand side. Insulin helps in regulating the blood glucose levels to a normal level between 80 to 120 to 130 milligrams per deciliter. So when the blood glucose exceeds the limit, it's called diabetes. Generally, diabetes can occur in three people. It can occur in young people, it can occur in middle age, as well as young people. It's basically three types. Type 1 diabetes occurs in children and young adults, where there is a complete deficiency of insulin. Type 2 diabetes is a type of diabetes which occurs in middle-aged people, and it can also occur in young adult people. This is where there is either a deficiency of insulin secretion, or the insulin which is secreted doesn't enter the cells, so that there is excess glucose in the bloodstream. The third type of diabetes is gestational diabetes, where diabetes occurs in pregnancy, and the diabetes continuously remains in the pregnancy, and as soon as the patient gets delivered, the diabetes goes off. But it is a variant of a type 2 diabetes. It's called gestational diabetes. There are other type of diabetes which can occur minimally, which can be due to malnourish induced or enzyme deficiency. There are some other types, but the main three are the type 1, type 2 and the type of gestational diabetes. Diabetes is uncontrolled blood glucose levels. It can lead to certain complications. If the glucose levels is not in control, it can lead to major organ damage such as heart, kidneys, eyes, blood vessels and nerves. So damage to the eyes is called retina. It can damage the retina of your eyes, so it causes retinopathy. It can cause nephropathy, that is damage to your kidneys. It can also damage your nerves, it's called neuropathy. So basically, glucose is measured in terms of milligrams per deciliter, and there is a 3 months HbA1c range called